Hello everyone, myself Gold Standard Medico. Welcome to my YouTube channel. So today we're gonna learn about complications of fracture. Okay, after the fracture of the bone, what are the complications that occurs in our body? So before we start, don't forget to like and subscribe my YouTube channel. Okay, so let's come to the introduction first. So after the complications of the fracture, there are associated pathologies other than the loss of bony continuity, which either coexist or originate due to fracture. Early diagnosis and aggressive treatment is necessary to minimize disabilities. Now we'll come into the classification of complications of the fracture. So first is immediate, मतलब after the fracture, after the bony fracture occurs, उसके तुरंत बाद क्या कॉम्प्लिकेशंस होते हैं हमारे बॉडी में, दैट इज इमीडिएट वन. तो इसके अंदर दो चीज़ आते हैं, सिस्टमिक एंड लोकल. सिस्टमिक में होता है हाइपोवोलेमिक शॉक, मीन्स आवर ब्लड फ्लो बॉडी में कम हो जाता है, हमारा ब्लड वॉल्यूम बॉडी में कम हो जाता है, उसके वजह से हम लोग को शॉक लग जाता है, जिसको अपन बोलते हैं हाइपोवोलेमिक शॉक. और उसमें लोकल में आते हैं इंजरी टू मेजर वेसल्स. तो मेजर ब्लड वेसल्स, फॉर एग्जांपल आर्टरीज और वेन्स में इंजरी हो सकती है, मसल्स एंड टेंडन्स में इंजरी हो सकती है, जॉइंट्स में इंजरी हो सकती है, एंड विसरा में इंजरी हो सकती है. देन अर्ली कॉम्प्लिकेशंस ऑफ फ्रैक्चर्स में क्या क्या आते हैं, तो इसमें भी सिस्टमिक एंड लोकल. सिस्टमिक में हाइपोवोलेमिक शॉक, ARDS. तीसरा फैट एम्बोलिज्म. चौथा डीप वेन थ्रोम्बोसिस एंड पल्मोनरी एम्बोलिज्म. फिफ्थ इज एसेप्टिक ट्रोमैटिक फीवर. सिक्स्थ इज सेप्टिसेमिया. सेवेंथ इज क्रश सिंड्रोम. एंड लोकल कॉम्प्लिकेशंस में आते हैं इन्फेक्शन एंड कंपार्टमेंट सिंड्रोम. Then, what are the late complications of the fracture? So, it is related to imperfect union. If the bone do not perfectly united, so that causes the complications, which is known as related to imperfect union. जिसके अंदर चार चीज़ हो सकते हैं, delayed union, non union, mal union and cross union. एंड अदर्स में आते हैं एवेस्कुलर नेक्रोसिस, शॉर्टनिंग, जॉइंट स्टिफनेस, स्यूडेक्स डिस्ट्रॉफी, ऑस्टियोमाइलाइटिस, इस्चोमिक कॉन्ट्रैक्चर, मायोसाइटिस ऑसिफिकेंस एंड OA. Then coming to the hypovolemic shock. So it is the commonest cause of death in fractures of major bones like pelvis or the femur. What are the cause of the hypovolemic shock? External or internal hemorrhage. Because of the external or internal hemorrhage, we will get a hypovolemic shock after the fracture. And what are the external? Compound fractures injuring major vessels of the limb. So basically compound fractures होते हैं that injures major blood vessels of the limb. And internal injury to the body cavities, for example chest or pelvis. Internal is more difficult to diagnose as compared to the external. Internal one is more difficult to diagnose. Okay, and pelvis 1.5 to 2 liters and femur 1.5 liters, it produces major hemorrhage. Okay, now what are the prevention of the hypovolemic shock? So early stopping of the bleeding, we have to early stop the bleeding. Second, avoiding shifting of the patients. We have to avoid the shifting of the patients because it is an emergency procedure. We have to emergency early stop of the bleeding. And for pelvis, temporary stabilization with external fixator, emergency angiography and embolization of bleeding vessels for deeper vessels. Then what is the management of the hypovolemic shock? Start even before the cause is established. Okay, 2 large bore intravenous cannulas put. Infusion 2000 ml of crystalloids, which should be the ringer lactate, followed by colloid, that is hamacal, and blood if needed. Cut down if peripheral vasoconstriction is present. Localize the site of lesion. If in body cavities, perform chest aspiration or diagnostic peritoneal lavage. Sometimes a simple chest X-ray is enough. Chest bleeding and abdominal bleeding में laparotomy. Then ARDS, acute respiratory distress syndrome. So it is a respiratory distress following a trauma. Okay, cause it is not definite. Hypothesized to be by release of inflammatory cells and proteinaceous fluid that accumulate in the alveolar spaces, leading to decrease in diffusing capacity and hypoxemia. The microvasculature is disrupted. Onset 24 hours after the injury. Okay, now what are the features we will see in ARDS? So there will be tachypnea, there will be labored breathing, there will be X-ray. In X-ray, we will see diffused pulmonary infiltrates and arterial partial pressure of oxygen is below 50. Then how would you manage the acute respiratory distress syndrome? It is 100% oxygen and assisted ventilation. We have to give oxygen, we have to assist ventilation. It takes up to 7 days to get the chest clear. 7 दिन लगते हैं पूरे चेस्ट को क्लियर होने में. If not detected early, death occurs by multi-organ failure और cardiorespiratory failure. If you are not detecting the early, अगर ARDS को पहले डिटेक्ट नहीं किया गया, so उसकी वजह से डेथ हो सकती है because of multi-organ failure और cardiorespiratory failure. Okay. Then coming to the fat embolism, It is a life-threatening complication of the fracture where fat globules occlude the small blood vessels. So it is a life-threatening complication of the fracture जहाँ पे fat globules क्या करते हैं? They occlude the small blood vessels. Embolism, as you know, is the process of occlusion of the blood vessel by any material which is brought to the site from elsewhere by bloodstream. Then, what is the pathogenesis of fat embolism? Injury to the large bones, for example femur, it releases fat globules from the bone marrow to the bloodstream. Okay? जैसे ही large bones में injury होती है, for example femur, तो उससे क्या होता है? It releases the fat globules. कहाँ से? From bone marrow to the bloodstream. Alternatively, fat can also be released from the adipose tissue. The fat globules obstruct capillary vasculature of the lungs. Okay. Also, fat is converted to free fatty acid, which induces toxic vasculitis, followed by thrombosis, which obstruct the microvasculature. What are the clinical features we will see in fat embolism? So common is petechial rash of anterior neck. Neck may we can get a petechial rash. Anterior axillary fold or conjunctiva we can get a rashes. And in cerebral type we will get drowsiness, restlessness, disorientation, coma. And in pulmonary type we will get tachypnea, we will get tachycardia, and we will get a respiratory failure. Then how would you diagnose the fat embolism? So we have to retinal artery emboli, यूरिन में फैट ग्लोब्यूल्स देखना पड़ेगा, चेस्ट एक्सरे में पल्मोनरी इन्फिल्ट्रेशन, दैट विल शो स्नो स्टॉर्म अपीयरेंस, विच इज वेरी इंपॉर्टेंट, स्नो स्टॉर्म अपीयरेंस. ओके. Then how do you manage the case of a fat embolism? So we have to give a respiratory support, we have to give heparinization, we have to give low molecular weight heparins, intravenous low molecular weight dextran we can give, corticosteroid we can give, dextrose and alcohol infusion to emulsify fat. Then, so most important complication of the fracture is deep venous thrombosis. Okay, it is the commonest complication originating from altered hemodynamics in lower limb and spinal injuries. Now, its pathology is very important. In pathology, we will see a Virchow's stride. What is Virchow's stride? Virchow's stride is the combination of three things. We will see in this decreased flow rate of the blood. So there will be decreased flow rate of the blood. There will be damage to the blood vessel wall. There will be hypercoagulability. And what is the pathology of the deep venous thrombosis is whenever there occurs a trauma, उसके वजह से हो जाता है इमोबिलाइजेशन की वजह से हो जाता है वेनस स्टैसिस, एंड वेनस स्टैसिस की वजह से हो जाता है थ्रोम्बोसिस. Then, what are the clinical features we will see in deep venous thrombosis is elderly and obese patients are at risk. So, the risk factors include elder people and obese patients. Okay, there will be leg swelling. Obviously, there will be leg swelling. There will be local redness, warmth. There will be calf tenderness. There will be pain in passive dorsiflexion. That is known as Homan sign. And venography shows deep venous thrombosis. Then, sequelae. The venous thrombosis can get dislodge and produce embolism elsewhere. Okay, if it is pulmonary embolism, the condition will be life-threatening. Embolism usually occur within 4 to 5 days after injury. A late complication of deep venous thrombosis is the post-phlebitic syndrome, which can manifest itself as edema, pain or discomfort, and skin problems. Then, what are the other causes? So there will be compression of the veins, that is physical trauma, cancer, infections, inflammatory diseases like stroke, heart failure, nephrotic syndrome. What are the risk factors is surgery, hospitalization, immobilization में आते हैं orthopedic casts, economic class syndrome, smoking, obesity. Age में आते हैं certain drugs, for example estrogen and erythropoietin, thrombophilia, pregnancy, postnatal period. Then, how would you diagnose the deep venous thrombosis? We have to see the D dimers. We have to go for Doppler ultrasound. We have to go for venography, and by clinical features, we can diagnose the deep venous thrombosis. Okay, and how would you treat the deep venous thrombosis? So prophylaxis, what we will give, active and passive calf, pump and toe movement. Okay, we have to actively and passively move the calf and toe. So active and passive calf, pump and toe movement. Elevation, third is deep breathing exercises. Elastic TED stockings we can give. Early internal fixation to provide early mobility. How do you manage? Complete rest with elevation, thrombolysis, anticoagulant therapy, graduated compression stockings, thromboembolic deterrent stockings, or intermittent pneumatic compression devices like respiratory support in case of pulmonary embolism. Okay. So this finishes our today's topic about the complication of fractures, and don't forget to like and subscribe. Thank you everyone.